Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're going to talk with Tom Boers of Hamilton Spine Health and Sport in Dalton, Georgia. Tom graduated from the Amsterdam Academy for Physical Therapy and then graduated from the School for Manual Therapy in the Netherlands. He is a fellow with the American Academy for Orthopedic Manual Therapists and has dedicated his career to orthopedic physical therapy with an emphasis on the spine. He practices at Hamilton Spine Health and Sport inside Bradley Wellness Center, located at 1225 Broadrick Drive, Dalton, Georgia. Hamilton Spine Health and Sport is comprised of a multidisciplinary team of manual therapists, a certified performance trainer, and a golf instructor. Today we're going to be talking about spondylolisthesis. Wow. Tom, what exactly is spondylolisthesis?
Spondylolisthesis is a condition where part of your spine actually has slipped forward. So if you can imagine, if you have like 33 blocks stacked on top of it.
Right.
And you go to the very bottom of the stack and you slide one of the blocks forward and it takes the rest of all the blocks with it. Okay, that is what spondylolisthesis is. And that is a situation that actually happens most of the time as part of our aging process.
Well, now, how does this condition happen? What causes that?
Well, when we age, our disc height, those are the cushions in between the vertebrae, when that disc gets smaller as a result of aging because we're losing the water content out of the disc. And that process typically happens in a relatively short period of time. And when that happens and you're losing height, and you know as we get older, we're getting shorter. So when we're losing height, it actually has some instability to it, means it can move. And then based on gravity, depending on how much we are tilted forward, your spine actually have the ability to start shifting forward.
Now, what are some of the symptoms if somebody thinks, maybe I've got this? What are some symptoms that go along with this?
Well, the interesting part of that is that you can have a spondylolisthesis and not having any symptoms. But what we see in the clinic is that people that develop spondylolisthesis typically starts to pitch forward a little bit because of the shift forward. Hey, your overall center point of gravity will go forward. So as a result of being tilted forward, your back muscles, as your hip muscles, your hamstrings, and your calf muscles all have to work harder to keep you upright. And when these muscles fatigue, your body starts to protect itself. Protection in your back means stiffness. So now your body doesn't let you bend forward anymore the way that you normally were capable of bending forward. Okay, this is what slowly becomes symptomatic. So this can start with back pain, lower back pain, hip pain, and because you're leaning forward, it can also start pulling some traction on your nerve roots, which you can create some leg pains.
Gotcha. Now, what about center of gravity? Do you have balancing issues?
Well, obviously, when you're stiffer, you will automatically be more hampered with your balance.
I would think so,
for
yes.
Sure. Now, to come back at that shift, the inside of our spine has a hole in it where our spinal cord and cauda equina, which is the bundle of nerves in the lower portion of the back. If you take two rings and you slide that forward a little bit, then the space for your nerves becomes less.
Oh, I see. So I can pinch that nerve?
Exactly. And that can give very typical symptoms as what we call claudication, which means that you have difficulty walking for an extended period of time, and that means your legs are getting dead. And the moment when you get out of that standing walking position and you go into bending forward or you go sit down, it sort of resolves the systems because that will open up that canal a little bit.
What can someone do?
Well, there are obviously several different options depending on the significance and the stage of the problem itself. Early on, physical therapy, and I mean a specific type of physical therapy, may help you to correct by getting rid of the stiffness that most often comes along with that.
So these are the goals of physical therapy.
Yes.
Get rid of the stiffness.
You got to get rid of the stiffness.
Gotcha.
So that we can correct your posture again. It will be critically important for your posture to be such that gravity does not keep pulling you forward. So there are some things that we can do to make the patients more aware. Mm-hmm. And as a result of that, it will reduce the tension on the back muscles, hip muscles, hamstrings, and calves. And that oftentimes resolves the symptoms that patients have.
Well, now, Tom, how are the Hamilton Spine Health and Sport physical therapists trained to help us if we are diagnosed with this?
So I started Hamilton Spine Health and Sport roughly about 10 years ago. And my training was such that we teach our therapists how to recognize this stiffness in your spine. And secondly, we train him how to specifically loosen that up. Once that is happening, then the hard part comes for the patient, because now they're going to have to learn to correct what they have learned over typically a long period of time not to do, and that is proper bending, proper standing, walking correctly, the most basic functions. And as you know, we're bending all day long.
That's right.
So if you're having a glitch there, it is not necessarily easy to just correct that. So that takes a lot of effort on patient side, but we will be there to help them.
Well, I got two questions. Is there a typical age that you see people with this condition?
Well, this part of the spondylolisthesis is typically in the aging population. So you're looking at something like from 40 years up. There's another form of spondylolisthesis, which is a developmental spondylolisthesis, meaning as we grow up as little children, your spine can have so much stress on the backside of it that it can actually break part of the spine.
Oh, no.
Which is called spondylolysis. And spondylolysis can lead to spondylolisthesis. So the forward shifting can happen once that part of the spine has fractured.
Now, would that take surgery to repair?
No, because that is actually what we call a fatigue fracture. That happens over a period of time till it finally gives.
Okay.
Again, this happens without symptoms. It's not like you're breaking your thigh bone. No, right. This happens over time. It's typically not symptomatic, but if it starts sliding forward and you create more stress on the structures on the backside, it can become symptomatic.
When it comes to physical therapy, is this like private one-on-one therapy?
Oh, absolutely. Yeah. I will see the same patient each visit.
That's fantastic. Now, can I go to any physical therapy clinic and receive this type of treatment for my back or my neck?
Well, that's just part of the problem, is that this kind of therapy that we do is not typically being taught in school. So you need to have special education after your graduation to do this. And the type therapy that we're providing at Hamilton Spine, because I got trained in the Netherlands, and I developed this system over the 48 years that I've been practicing.
Wow.
So you don't get that in many places because, it's only the courses that I teach.
Got you. Tom Boers, great. It's always good to have you on the show, and I appreciate you coming in and talking about this. We've learned so much. It was great having you here.
Thank you, Bob. Anytime.
For more information or an appointment at Hamilton Spine Health and Sport, call 706-529-3686 or visit hamiltonhealth.com/spine-and-sport. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.